This is the annual Infection Prevention and Bloodborne Pathogen presentation. Objectives for training. Identify links of the chain of infection. Select methods to control infections. Review standard precautions. Review bloodborne illnesses. Identify proper techniques of hand hygiene. Review areas included in exposure control plan. Generate awareness of hepatitis and COVID-19 vaccination availability for interested staff. Identify proper use of PPE. Review tuberculosis. Gain awareness of sepsis. Generate awareness of facility antibiotic stewardship. What are bloodborne pathogens? Pathogens are microorganisms such as bacteria, fungi, or viruses that can come in contact with human beings and cause disease. Bloodborne pathogens are present in human blood or bodily fluids that can lead to disease. Hepatitis B, or HBV. 1 in 20 Americans are infected. Symptoms include jaundice, which is yellowing of the skin, fatigue, abdominal pain, loss of appetite, intermittent nausea, vomiting. It may lead to chronic liver disease, liver cancer, and death. HBV can survive for 1 week in dried blood. Up to 40,000 new infections occur each year. Hepatitis C, or HCV. Hepatitis C is the most common bloodborne infection in the United States. Symptoms include jaundice, fatigue, abdominal pain, loss of appetite, intermittent nausea, or vomiting. This may lead to chronic liver disease and death. HIV, or human immunodeficiency virus, is the virus that causes AIDS, acquired immune deficiency syndrome. HIV affects the body's immune system. HIV does not survive well outside the body, which means most infections occur from direct bodily fluid contact. Estimated 1.1 million people are living with HIV, and once you contract HIV, it is a lifelong infection. Other bloodborne diseases are caused by viruses or bacteria. They circulate in the blood at some phase, capable of being transmitted. Most rare in the United States. Examples of these are the Zika virus, which is pictured on the left, and Ebola on the right. Other examples of bloodborne diseases are hepatitis D, syphilis, malaria, babesiosis, brucellosis, leprospirosis, arboreal infections, relapsing fever, and Creutzfeldt-Jakob disease. There is a risk of exposure when you are exposed to blood, other potentially infectious materials such as human bodily fluids, any unfixed or exposed tissue or organ from human, cultures, culture mediums, or other solutions, experimental animal blood, tissues, or organs infected with HIV or HBV. COVID-19, also known as the novel coronavirus. It is a respiratory virus that is very contagious. It travels from droplets when an affected person sneezes or coughs and is inhaled by a not yet infected person. It severely affects the lungs' ability to distribute oxygen and causes difficulty breathing. Symptoms include shortness of breath, headache, chills, sore throat, gastrointestinal upset, such as nausea or vomiting, dry cough, loss of taste or smell. TB is a potentially serious infection that mainly affects the lungs. The bacteria that causes TB is transmitted into tiny droplets in the air from coughs and sneezes. Your body can harbor the bacteria that causes TB, but usually your immune system can prevent you from becoming sick. There's 2 different distinctions of TB. Latent TB is an infection present, but the bacteria remains in your body as an inactive form. This causes no symptoms, but this does require treatment as soon as possible because the infection can become active at any time. Active TB is a condition that causes symptoms and is very contagious to others. It can occur within the first few weeks of exposure, or it may occur years later. TB can also affect other body systems such as kidneys, the nervous system, and others. Symptoms may vary, but may include coughing that lasts more than 3 weeks, coughing up blood, chest pain or pain with breathing or coughing, unintentional weight loss, fatigue, night sweat, chills, or loss of appetite. All residents or patients are required to be screened for TB upon admission. All Baptist employees are given a two-step TB test upon hire and then are required to complete a TB questionnaire yearly. A resident may not stay at Baptist with an active TB infection. They require special isolation rooms that are not available in this facility. Healthcare-associated infections refers to an infection associated with healthcare delivery in any setting. Examples include a catheter-associated urinary tract infection, such as a urinary catheter that is inserted improperly, which causes a UTI, or a resident contracting an illness from a sick staff person. It is important to work as a team to prevent infections. Antibiotic stewardship. There are state and federal regulations to limit the use of antibiotics in hopes of preventing an antibiotic-resistant infection. The Infection Control RN tracks all antibiotic usage in the building. This is why proper documentation of antibiotic usage is so important. In the 24-hour report, please include the type of antibiotic, the day number of the antibiotic, and the reason for the antibiotics so that it can be properly reported. Sepsis is a life-threatening response to an infection that can lead to organ failure and tissue damage. Who is at risk for sepsis? Anyone with any type of infection. People over the age of 65. Anyone who has a chronic illness. Any person who is immunocompromised. Anyone who was recently hospitalized or had a recent surgery. Early symptoms of sepsis include infection confirmed or suspected, fever or feeling very cold, rapid heart rate, decreased heart rate, rapid breathing or shortness of breath, altered mental status, behavioral changes including agitation, difficulty arousing the client, pale or discolored skin, and poor motor skills or dizziness. This is the chain of infection. It begins with the pathogen, such as the bacteria, virus, fungi, or parasite. The pathogen then goes to the reservoir, which is people, animals, soil, food, or water. The portal of exit is when people cough or sneeze, their bodily secretions, or their feces. The mode of transmission is either by direct contact, indirect contact, or vectors. This is for diseases such as Lyme disease, where a mosquito is used as a vector. The portal of entry is the mouth, the nose, the eyes, or any cuts in the skin. And susceptible hosts are the elderly, the infants, and immunocompromised, but anybody is a susceptible host. How does exposure to bloodborne pathogens occur? Needle sticks, cuts from other contaminated sharps, contact of mucous membranes or broken skin with contaminated blood or other potentially infectious materials, or OPIM. First responders, housekeeping personnel, nurses, and other healthcare personnel are at risk for occupational exposures. The CDC estimates 5.6 million workers in healthcare and related occupations are at risk. All occupational exposures to blood, or OPIM, places workers at risk. The employer has the responsibility of providing a hazard assessment, identify and provide appropriate PPE to employees at no cost, train employees on the use and care of PPE, maintain and replace the PPE, review, update, and evaluate the PPE program. The responsibility of employees include properly wearing the PPE, including the donning and doffing, attending all trainings, caring for, cleaning, and maintaining the reusable equipment, notifying appropriate staff when repair and replacements are needed. Engineering and work practice. Provide safer medical devices, such as self-retracting needles. Preventing bloodborne pathogen exposure. Change the sharps container when it is at the fill line. Do not overstuff it. Activate the safety features on the needles after use. Push in the retractable needle. Never recap a needle after use. Dispose of blood-soaked materials in red biohazard bags. Double bag blood soaked linen and tie. Use standard precautions when giving injections, drawing blood, and obtaining finger sticks and accessing IVs. Controlling exposures. Observe standard precautions. Treat all blood and bodily fluids as if they are contaminated. Proper cleanup and decontamination is important. The Exposure Control Plan, or ECP, is a written plan that is reviewed annually or more frequently if needed. This determines exposure, shows the schedule and method of implementation, explains procedure for evaluation of exposure incidents. This procedure is located in the red Fire and Disaster binder located on each unit, in the supervisor's office, and the education office. When employers are selecting personal protective equipment, it must have safe design and construction, it must fit comfortably, there must also be required training. The required training must include when the PPE is necessary, what type is necessary, and if different departments require different types of PPE, the proper donning, adjusting, and doffing, the limitations of the PPE, the proper care, maintenance, useful life, and disposal. Personal protective equipment includes gloves, surgical masks, gowns, face shields, safety goggles, PAPR hood ventilators, CPR masks, and N95 ventilators. Donning PPE. You must don PPE before entering an isolation room. Wash your hands with alcohol-based sanitizer or with soap and water before donning PPE. Put the gown on and secure it in the back. Put on the mask and goggles if required. Pull on gloves one at a time and pull over cuffs of gown. Doffing PPE. Remove PPE prior to leaving isolation room. Remember, the outside of your PPE is considered contaminated or dirty. Remove gloves, pulling off one and placing it on the palm of the gloved hand and pulling that glove over the first glove. Unsecure and grab the inside of the neck of the gown and pull the gown away from the body inside out and slowly bundle and place in proper receptacles. Please note if your gown is disposable or reusable. Remove mask by touching ear loops or back ties and goggles. Wash hands immediately. Proper hand washing. Wash hands for a minimum of 20 seconds with warm soapy water. Use friction while scrubbing hands, going in between fingers, under nails, up to your wrist. Dry your hands with a clean paper towel. Use another clean paper towel to turn off the faucet. Hand washing is the #1 way to prevent infection. It is the responsibility of housekeeping to utilize a written schedule for cleaning and decontamination. Also for picking up broken glass. Do not ever pick up broken glass with hands. Only use mechanical means, which is a plastic scoop with scraper or plastic tweezers. When cleaning up and decontaminating, wear protective gloves, use appropriate approved disinfectant, clean and disinfect contaminated equipment and work surfaces, thoroughly wash up immediately after exposure, properly dispose of contaminated PPE, towels, rags, etc. Contaminated laundry must be bagged or containerized at the location where it was used. Never hold soiled linen close to your body. Linen is to be bagged in clear bags and tied. Resident laundry is to be in blue bags only. No red bags or biohazard stickers are to be used. Transmission-based precautions. In addition to standard precautions, additional precautions may be required based on resident condition. Pathogens spread by airborne such as TB, droplets such as COVID and influenza, contacts such as ESBL and MRSA, pathogens such as C. difficile containing spores require hand washing with soap and water. Be mindful of the signs that are on the residence doors and don the PPE that is listed. There should be a cart in front of every room that will have all the PPE required. COVID precautions. At Baptist, any unit or resident on full quarantine requires both droplet and contact precautions, which includes a face mask at all times, face shields at all times, isolation gown while doing any task involving direct resident contact or while touching dirty items, gloves while performing any direct resident care or while touching dirty items. Hand hygiene, which is washing hands with soap and water or hand sanitizer. Gloves and gowns must be changed between residents. Masks are changed when soiled. Shields are to be disinfected when soiled and changed every 14 days. Gloves, gowns, masks, and shields are to be worn when transporting linens that are contaminated with an infectious disease such as COVID. Never shake soiled linens. Never combine COVID soiled linen with non-contaminated linen. Tie bags to prevent spillage. Notify laundry personnel of contaminated laundry. Hepatitis B vaccine is offered to all potentially exposed employees. It is provided at no cost. Declination form must be signed if you do not wish to receive vaccination or have previously received vaccination elsewhere. Currently, there are no vaccinations available for hepatitis C or HIV. There is preventative medication given to people that are at high risk for contracting HIV. When an exposure occurs, this includes a specific eye, mouth, or other mucous membrane, non-intact skin, parenteral contact with blood or OPIM that results from the performance of an employee's duties. Immediate action should be washing exposed areas with soap and water. Flush splashes to nose, mouth, or skin with water. Irrigate eyes with water and saline. Report exposure immediately to nursing supervisor. Direct employee to healthcare professional for treatment. When an exposure occurs, there is confidential medical evaluation and follow-up. The route of exposure, the source individual, collecting a blood test for HBV and HIV, post-exposure prophylaxis when medically indicated, counseling, and evaluation. This concludes the PowerPoint. Please complete the test.